Hello, this is Dr. Kalpana Sringar from Prakruthi Charitable Foundation. Welcome to my channel, Tuning a Fragile Mind. Today, let me tell you a little more about how you should take care of a psychologically disturbed patient at home and the precautions that you need to take when a patient is at home. Now, supposing you get a case of a bipolar disorder, a person who is in a manic phase, wherein he's extremely violent, he talks too much, he's abusive, and he cannot control his emotions. He may beat you, he may try to threaten you. So how do you take care of such a patient at home? Do you argue with him? Do you restrain him? Do you tie him up? Or do you isolate him in a room? Such things will not help at all. The best thing that you could do at such a time is don't argue with the patient. Just sit and listen to all the things that he's going to tell you. He may abuse you. Don't get angry. He's not doing it intentionally. Just wait for him to calm down. Once he calms down, try to put a little sense into his head. He should understand that you're not there to listen to all this nonsense. And at the same time, he should get a feeling that what he did was wrong. It should be brought out only with your emotions. Just sit down and quietly listen to all that he's talking, and supposing he's destroying anything, just bear with it for some time instead of you losing your temper. This will instantly calm the person down after a few minutes. Then you tell him, give him his medicines on time. See that he takes it. See that he swallows his medicines. There are many people who just trick you. They do not swallow all the medicines. They may take one or two and throw the rest. Or they may go to the washroom and they may spit it out. We have found so many patients like that who just keep it inside their mouth and go and spit it out later. Such people will not improve. So it is the duty of the caregiver to see that these patients take their medicines on time and see that they swallow the medicines. See that they don't throw it out. And give them the required medicines at that particular time. Don't give them the whole lot and ask them to take it, once in the morning or once in the night according to their prescription. Don't do that, because they may swallow everything together. They are not in their senses to do the right thing and follow your instructions. So you as a caregiver should see that they take their medicines on time and see that they swallow it. Supposing it's a case of depression, when the patient is totally depressed, crying, and then does not want to live, does not want to eat, does not want to sleep, talks about committing suicide. What do you do with such a case? All that you can do is hide all the sharp instruments that are there. See that they are not within his reach. Don't keep things which he can consume. In the sense, some insecticides, pesticides. Don't keep all this within his reach. And as far as possible, be vigilant. He can do anything at any time. I can give you an example of a lady who came to us long back. She was a chronic schizophrenic. And she used to take her medicines, no doubt. But that particular day, for some reason, they forgot to give her the medicines on time, and it was delayed by an hour or two. Her whole problem aggravated because she had no children, and her sister-in-law had produced a child. So she wanted to go and kill the child. At that particular time, when they went and caught hold of her and said, "This is not what you should do. Think that is your child and take care of that child properly." She got very angry, and they were living in an apartment. She started running from one floor to the other, and then finally when she saw that somebody was following her, she jumped from there. She jumped from the 4th floor and she died on the spot. If you don't give medicines on time and the prescribed dosage, things like this can happen. So my sincere advice to all of you is, see that they take medicines on time. And if it's a case of a patient showing negative symptoms like withdrawn behavior, he does not want to talk, or he does not want to change his clothes, he does not want to bathe, he does not want to eat on time, he does not sleep, he just keeps staring at the space, then what do you do with such a person? You have to see that his hygiene is maintained. See that he brushes his teeth, see that he takes a bath, see that he eats properly. Because such people normally don't die because of their illness. They die because of certain infections and certain comorbid conditions. For example, a patient could have diabetes, a patient could have hypertension, or the medicines that the patient is taking could cause diabetes. Supposing you stop the antipsychotic drug and say that, oh, this has made him diabetic, and if you stop that, his mental illness will progress. You can't arrest the illness. It increases. So you have to weigh the consequences. Even if he is diabetic, see that his blood sugar levels will not go high, and at the same time, see that he takes the antipsychotics that really suit him. So you have to balance the situation. Always remember not to keep a very frail person next to a very violent patient. Don't keep old people to take care of them. Don't leave small children or babies next to these patients. And with people with postpartum psychosis, just see that you isolate the baby from the mother. Do not give her the baby because she could harm the child. And the other thing that you should remember is, assuming you appoint some person to take care of these patients, see that those people are really dedicated to take care of such patients. They should not beat them, they should not abuse them. See that, they take care of the patient with a lot of love and care. And the other thing that all of you should remember is, whenever you come across old people who are having dementia and things like that, when you are unable to take care of them at home, it's better you try to institutionalize them, or at least send them for a daycare or a halfway home facility wherein there are experts to take care of such patients. We get a lot of such cases with postpartum psychosis, with the bipolar disorder, with schizophrenia, people showing withdrawn behavior, and we try to rehabilitate them in our center and we send them back. We also psychoeducate the parents or the key relatives of the patient. And please seek help if at all you require. If you require any details about how to take care of these patients at home, please approach us and we'll be very happy to explain these things to you. Thank you so much.